Hello, I'm Dr. Vijay Kumar. I'm professor and head of the Department of Pediatric Surgery. We deal with the different types of surgical problems in children. It may start from newborn period to teenage. So there are different types of surgeries. Like in newborn babies, we deal with the congenital anomalies. Like example, if there's a block in the food pipe, if there's a block in the intestine, or if there's a block in the kidneys or in the bladder. So many other conditions or sometimes respiratory problems. Most of the time newborn surgeries will be emergencies, and after newborn age there will be different other spectrum of problems which will come in children. Example, like the intestine infection, block in the intestine, kidney tumors or malignancies or head and neck lesions or hepatobiliary, the different types of lesions in the liver or pancreas, different types of problems they come in pediatric age group. So we usually deal with these surgical problems in pediatric surgery. The manifestation of these surgical problems are depending on the age and depending on the type of problem. Baby will have, or the kids will have different recurrent pain abdomen, or recurrent vomiting, or recurrent urinary infections. So the important part of pediatric surgery is the evaluation or the identification of these lesions. So once we have diagnosed the surgical problems in babies, we prepare them for surgery. During surgery and after surgery, all the procedures, all the management will be discussed with the parents. When the mother is there with the patient, the baby will be more comfortable. So most of the parental anxiety or apprehensions or how baby will cope up with the pain or the nutrition or feeding after the surgery, if it is a smaller surgery or major surgery, we explain them. Basically, we pediatric surgeons, we work as a team. We have a team of pediatric surgeons, we have pediatric anesthetists, we have team of sisters. So pre-op care, post-op care, everything will be done in a team. Majority of my patients come in the OPD are recurrent pain abdomen. Parents are worried about the recurrent pain abdomen, which is come in the way of their daily routine and history of vomiting sometimes. So usually I concentrate on their food habits. Most of these patients or the kids, they are into low fiber diet, in the sense they will be used for junk food, not much vegetables or fruits or hydration. So this can lead to constipation in these kids, and this constipation can lead to a recurrent pain abdomen because of the recurrent enteritis. So most of these kids, their pain abdomen will settle with improvement of the diet. If it is not settling, then only we start evaluating the cause for pain abdomen. So one more commonly seen problems is genital problems in kids. So either there is a swelling in the scrotum or inguinal region, or if there is a abnormal urinary opening, we call it as hypospadias, or sometimes abscess of the testis in boys. So these are very common problems, and parents are worried about these problems. So what my advice to the parents is, whenever they see the genitalia is not normal, they have to visit pediatric surgeon at the earliest, because a condition like undescended testis, wherein the testis has not reached into the scrotum, it has to be addressed before 1 year of age group. Or if it is a hernia, it has to be treated early, because it can go for complications if you don't treat these patients early. You should not worry about the surgery. If you delay it, then there can be complications and there will be more problem to the patients. Whatever the surgical problem, take an opinion from pediatric surgeon, and accordingly we can proceed, because in the early stages the treatment will be easier and later on it will be more difficult. So message to all the parents is, so whenever you feel there is any recurrent problems like pain abdomen, recurrent vomiting, or recurrent urinary infection, you consult pediatric surgeon for evaluation. So don't ignore or don't stop with antibiotics. Don't ignore any of the symptoms. That will be the first message to parents. Whenever you see a small cyst, small swelling, small sinus, anywhere in the body, take a surgical opinion. First and foremost is, don't worry about the surgery. It's safe in pediatric age group. We have team of experts in either sisters, doctors and anesthetists and the infrastructure everything can help out for your recovery of the babies. So that can be taken care as a teamwork, so that surgery in pediatric age group, you should not worry. Thank you.